This is the first in a series where Aldertrack speaks to policymakers and implementers about how city government impacts the work they do. I'm Mike Fouché, publisher of Aldertrack, and today we're talking with Craig Maki, Executive Director of Asian Human Services. Asian Human Services serves about 30,000 people a year in Uptown and around the north side of Chicago, and you have a budget of about $16 million. Craig recently took over Asian Human Services after a career of working in and running other social service providers in Chicago. So Craig, let me ask you, how far behind is the state and the city in their payments to you right now?
Over 100 days.
Over 100 days.
Depends on the grant, depends on where it's coming from, but we're owed anywhere between 100 and 140 days.
How does that impact what it is that you do? How do you work that out?
I think we've been fortunate that my predecessor that I replaced, Abba Pandya, who did a wonderful job of making sure that as an organization we were diversified. So we're about a third city funded, about a third federal funded, and about a third state funded. That being said, what we're able to do is kind of rotate between all of the funding sources, who's paying us when, how much, in working with our banks to be able to juggle it. But if we were only a single source agency, it would present great challenges because there isn't a constant. We get cash flow coming in from those different sources, so it allows us to be somewhat flexible with how we work.
What kind of, have you received warnings from people in the city government and from state government?
So what we've heard from the state government was the same thing I think a lot of people have heard of. No bills are being paid after July 1st. Employees are going to be asked to come to work at the state level, and us as social service providers have been asked to continue providing services to the best of our ability.
Free of charge?
Yeah, that doesn't ever come up. It doesn't get stated. Yes, free of charge, but that's the implied consequence. And the uncertainty is in history. We would have 1 month appropriation so we could figure out how to manage our staff of who can we keep around. As much of what we do is related to FTEs related to grants. Mm-hmm. So if one grant gets cut, then we need to rotate those FTEs within the organization or furlough or whatever we need to do. And so it's becoming, that part is going to be a little bit challenging. Mm-hmm. Of this, please keep doing it without the certainty that we're going to be made whole once a budget passes. In the past, that's kind of what people have thought, but what the word on the street is, that may not be the case.
So this seems dramatic, but do you have a break point? Is there a point where you say, boy, at this date, we're going to have to really start cutting some services and we're not going to be able to exist the way that we have for the last 35 years?
I think that's tough, but my guess would be most larger organizations have 30 to 60 days that we can make things work. We can get really creative to get to 60 days. The problem with it is in some of that creativity, my biggest fear is I may lose staff that I can't get back because they need to go take care of themselves and they need to do things. And what happened the last time the state sort of went through this in the city, a lot of people left social services because of this uncertainty. Very, very well qualified folks, very dedicated, and they said, you know what, I can't do this again.
So if there's no clear resolution to the budget by September 1st, things are really...
I think that's going to put people in a pretty tricky spot. And the other side of it is, the big unknown right now is, historically, they would pass 1 month appropriations and we would keep moving. And any services we were sort of doing on ours, sort of funding it, they were made whole. Mm-hmm. It's been put out there already that there's no intention to do that, or at least no intention to say you should expect that to be the truth again this time. Mm-hmm. So that makes it real tough to say how much cash can we actually put out with the idea that we may never see it again. And so even if a budget does get signed and things are appropriated, some of the residual effect is going to be. How much debt can certain organizations take on? Even if they get their contracts, they're going to need to pay on that debt. And most of them are running at such a tight margin that carrying additional debt may be detrimental.
So this is maybe the third or fourth time that we've gone through this sort of thing with the state, and it's really big problem that we have with the city. And it seems like this sort of budget problem is not going to go away for Chicago. Chicago is going to have a long workout period. Is this sort of thing the new normal for social service agencies?
I don't know why we wouldn't expect that, and I think the more that we just start assuming this is how we need to plan and budget, the better off we're going to be. I know for us, we work off of a budget, and then we really fine-tune that over the first 4 or 5 months. Once we figure out, did the budget pass? What grants got cut? What grants did we apply for that came in? And so you really have to be fluid with how you do it, and you need to have the cash resource lines through your creditors or fundraising or other unrestricted dollars to help bridge this initial gap, because everybody runs through this, and I don't think should expect not to. July through November is very much you plan to stay where you're at.
What are some of the danger signs that we should expect to see for these organizations out there? What are the different ways that we as average citizens and people who are working with government one way or another, what are some of the things that we should expect to see that alert us that places aren't going to make it?
In the social service field, the ones that typically get all of the bad press attention are the psych hospitals and residentials when bad things happen. But for the bulk of social service, it's serving folks in the community who are still tied in with families in the community and those things. What you're going to see happen is a lot of these smaller agencies, or even us, if we have to start cutting back on services, kids aren't going to be able to go to the after-school programs or affordable child care. Seniors aren't going to be able to get the in-home support that is being able to be provided. Cutting back on medical services, mental health services. And what's going to happen is these people that are otherwise taken care of, somebody in their family unit, if they have one, is going to have to cut back on work. Somebody's going to have to take care of that person. And so I think we don't talk about enough, or we don't pay enough attention to the unintended economic impact, not to the social service agencies, but to the families that are going to be forced to be put in positions where they're working class families that can't afford to go pay for private services. They rely on us to provide a blended funded service. And I think if we pay attention to that, you'll start seeing a lot sooner the actual impact on the folks of Illinois, instead of looking to see who hits the newspaper or who's got the rent signs up. I think we'll see the hurt a lot quicker at that familial level of what are we going to do.